Welcome to HESI Test Prep 2025. The HESI exam is an entrance exam required for many nursing programs. It's a predictor of nursing student success, and many schools use the exam as a part of the admissions criteria for acceptance. Not all colleges and universities use HESI. The HESI Test Prep app helps you to collect resources for exam prep. Just open up the Google Play Store and install the app. In today's lesson, we will discuss some important questions about nursing procedure. Question 1. Which of the following is an important consideration when preparing a patient for an MRI? Option A. Ensure the patient has a clean shave option. B. Remove all metal objects. Option C. Administer a sedative before the procedure. Option D. Ensure the patient wears a compression garment. Answer is B. Remove all metal objects. Question 2. Which of the following is the correct site for a newborn's first blood draw? Option A. Heel. Option B. Finger. Option C. Ankle. Option D. Scalp. Answer is A. Heel. Question 3. What is the main reason for using a tourniquet during venipuncture? Option A. To prevent blood flow. Option B. To dilate veins. Option C. To stop bleeding after the procedure. Option D. To disinfect the area. Answer is B. To dilate veins. Question 4. When administering a medication via the intradermal route, what is the ideal angle of injection? Option A, 15 degrees. Option B, 45 degree. Option C, 90 degree. Option D, 60 degree. Answer is A, 15 degree. Question 5. What is the priority intervention for a patient with a high-risk surgical wound? Option A, maintain a low-protein diet. Option B, monitor for signs of infection. Option C, administer pain relief. Option D, encourage mobility. Answer is B, monitor for signs of infection. Question 6. Question 1. Which of the following is the most appropriate action when a nurse is performing hand hygiene before a sterile procedure? Option A, scrub hands with soap for 10 seconds. Option B, use alcohol-based hand rub until hands are dry. Option C, rinse hands with warm water. Option D, apply hand lotion after washing hands. Answer is B, use alcohol-based hand rub until hands are dry. Question 7. When administering an intramuscular injection, the nurse should. Option A, use a 25 to 27 gauge needle. Option B, insert the needle at a 45 degree angle. Option C, choose the deltoid muscle for injections in children under 2 years old. Option D, aspirate after inserting the needle to check for blood return. Answer is A, use a 25 to 27 gauge needle.
Question 8. Which of the following steps should the nurse follow when performing a sterile dressing change on a wound? Option A, clean the wound from the outer edges inward. Option B, use non-sterile gloves to remove the old dressing. Option C, ensure that the sterile field is established before removing the old dressing. Option D, use the same gloves throughout the procedure. Answer is C, ensure that the sterile field is established before removing the old dressing. Question 9. Which action should the nurse take first when a client experiences anaphylaxis after an injection? Option A, administer oxygen. Option B, call for emergency help. Option C, administer epinephrine. Option D, check the client's vital signs. Answer is C, administer epinephrine. Question 10. When teaching a patient about proper use of an inhaler, which instruction should the nurse include? Option A, inhale quickly while pressing the inhaler. Option B, hold the breath for at least 5 seconds after inhaling the medication. Option C, use the inhaler every 4 hours regardless of symptoms. Option D, use the inhaler only when symptoms are severe. Answer is B, hold the breath for at least 5 seconds after inhaling the medication.
Feel free to join us at HESI T's Test Prep private study group or follow us on HESI and T's study group.